Hi, this is your host, Ryan, and I'm here today with our special guest, Dr. Beverly Yates. Dr. Beverly is an expert on weight loss and women's health, including PCOS weight loss. She has over 2 decades of clinical experience. She's a caring doctor and lifelong athlete. In her former career as an MIT-educated electrical engineer, Dr. Beverly was a problem solver. And now as a doctor, she continues to use her problem-solving skills to help other women solve their weight loss problems. In today's interview, part of Dr. Beverly's PCOS weight loss tips series, we're going to be talking about PCOS weight loss and exercise. Dr. Beverly, thanks so much for being with us here today.
Hey, how are you? I'm glad to be doing this.
And I think this is a perfect time to be doing this talk because it's a time of year when exercise is often the furthest thing on people's minds, but it's more important than ever. And so let's just dive right in. I think from our past conversations, many of the women who have PCOS and are looking to lose weight, I kind of get the sense, and I might be wrong, that they think if they just focus on their diet, that they don't need exercise. And I want you to tell me, is that true?
Yeah, that's a great question. You know what? No, that's a mistake. So let's take apart some of these myths. For many women, much more so than men, when they want to lose weight, they think the thing they should focus on exclusively, right, is diet. And that's a mistake. Women really do need to also focus in on exercise along with diet, and particularly for PCOS. And, the weight loss is likely to be slow and steady. It isn't likely to be a spectacular, I lost 12 pounds in a week. Not so much. But really, it's a mistake to think that just diet alone will lead to getting the desired weight loss results. It's much more realistic to use both specific diet choices and exercise together for sustained weight loss benefits.
So, for PCOS weight loss specifically, is success really tied to exercise then?
Yeah. Yes, it is. Yes, it is. For women with PCOS who are successful at losing weight, it's more common that they both eat in a way that helps them lose the excess weight and, let me say that again, and that they exercise regularly. It's not common that they'll be successful if they just diet alone or if they just exercise alone. They usually need the combination of paying attention to both what they eat and the exercises, and that will lead to losing the extra weight.
Well, let me ask you a question. I know from our prior podcasts and your blog posts and the other stuff, the other articles that you've written that I've read, that it seems like blood sugar control is really a necessary ingredient for PCOS weight loss. Now, my question is, what sort of effect, if any, does exercise have on keeping blood sugar in that normal range that you talk about so often?
Yeah, exercise is a really important partner in keeping blood sugar under control. It helps to keep it in the normal range. And exercise can also help to tame cravings for foods, including troublesome sugar cravings and fat cravings. It also helps to smooth out mood swings, too, if that's an issue. Exercise is a really helpful friend for PCOS weight loss success. It's a great partner on the team.
Interesting. So now, another topic that we've touched on in a number of the interviews that we've done together is fertility. And I'm curious, since we're on this topic of exercise today, does exercise have any impact on fertility when a woman has PCOS?
Yes, absolutely. Fertility is improved with regular exercise. And it's interesting, because you wouldn't think exercise would have anything to do with fertility, but they are related. And a lack of exercise can interfere with fertility, making it harder to conceive and have a baby, especially if blood sugar control is poor. And a lack of exercise can lead to weight gain, and weight gain can also interfere with fertility in women. It's definitely related. So both my clinical experience as a doctor and scientific research available to anyone who wants to look online both clearly show that fertility is improved with these 3 things. First is regular exercise. Second is keeping your weight in a healthy range or getting it back to a healthy range. And the third, keeping your blood sugar balanced. So the good news is if you work on any one of those things, either the exercise side or the balanced blood sugar, you're probably going to get the benefits across the board.
Interesting. What about some of the other symptoms of PCOS that I know we've talked about before, like excessive hair growth in unwanted places or like acne, for example?
Sure, and then problems also with fertility. Yeah, exercise can affect these other PCOS symptoms and in a positive way. I think the positive effects, in my opinion, that exercise has on regulating the blood sugar spill over into other PCOS symptoms, especially fertility. Good blood sugar balance improves fertility when you have PCOS, and excessive hair growth tends to become more manageable with better blood sugar control. acne improves too, in part because of improved blood circulation in your skin as a normal response to exercise.
So I want to switch gears a little bit because obviously our topic here is specifically focused around PCOS weight loss. But if we talk about sort of general weight loss advice that you hear, on TV or books that you read or might see in something you might see in a magazine, it seems that sort of the typical advice that you hear is to exercise 3 to 4 times a week, maybe 20, 30 minutes each time. And I'm curious, does that same sort of rule apply for PCOS weight loss?
Great question, Ryan. And the answer is no. Typical exercise advice does not apply to PCOS weight loss. The women I've worked with over the years and other information that I have really points out that exercise at a rate of 3 to 4 times a week and 20 to 30 minutes is just not enough. So a workable plan, though, that leads to weight loss results is going to be daily exercise, along with doing different kinds of exercise, what some people will call cross-training, throughout the week. Taking 1 to 2 days off, not more than that, from formal exercise a week is okay, as long as on the off days you are still moving, whether it's dancing or skating or other forms of moving that can be vigorous. You don't necessarily have to be stuck in the gym 7 days a week, but you really do need to be moving and physically active each and every day. And let me say this because it's really important. You got to focus in on the types of exercise that you truly enjoy or can at least do on a regular basis. For instance, if you hate team sports, then don't build an exercise plan that includes stuff that you really, don't like or hate. Because you know why? It means you won't do it and you'll eventually quit. We're talking about building in habits for a lifetime here. So it's not good if you're going to set yourself up for failure by focusing in on doing exercises that you know you can't stand. You want to have fun with your exercise, whether it's at home, in the health club, or at a gym, at a pool, or outdoors. You want to keep it fun and make it work for you and your needs. As long as you're actually doing it, that's what matters. You can't set up something that's going to be impossible to actually do because, of course, it'll be a failure.
Right. No, it totally makes a lot of sense. Now, that was extremely helpful because I think that dispels a lot of the myths and maybe some of the frustrations that women struggling with PCOS might have who have done some exercise in the past and they're listening to this saying, but exercise doesn't work. I've tried that. Mm-hmm. It might just be that the way in which they've been exercising just hasn't worked.
Yeah, that has been the issue, actually.
So we talk about a number of things related to exercise right now, and I'm curious, aside from, in addition, I guess, to losing weight, what sort of other effects on a person does exercise have? Like on things like mood and mental well-being. Does exercise have any sort of positive impact on a woman suffering from PCOS on her mental outlook?
Yep, you bet it does. Exercise can really help a woman who's wrestling with PCOS to feel like she is taking charge of her situation. Exercise can really help her to feel powerful and truly contradict any feelings of being a victim to her body and its bothersome symptoms of PCOS. This is important because when you feel better about yourself and know that you are taking care of yourself as best you can, you are more likely to make choices that support your well-being. You're much less likely to fall into emotional traps that can cause you to do stupid stuff you know will destroy your good work to lose this PCOS weight. You get smart about your triggers for overeating or eating junk foods or avoiding exercise or eating foods that you know are trouble for you, or maybe you're in the habit of not planning your meals and always, being at a mad scramble trying to figure out what you're going to eat, right? So instead of planning for success, you wind up not planning, which means you're planning for failure. And so that way you can sidestep those traps that keep you from those weight loss results that you want and deserve. Exercise really helps to build in good personal habits and good choices throughout the day, day after day.
So true. What about, certain types of exercise? Like, for example, is it okay for women with PCOS to do weightlifting or lift weights?
Yes, particularly in the case of PCOS, it is okay to do weightlifting. It's important to watch how your body responds to the weightlifting. Keep in mind that with weightlifting, also called resistance training, it really is very, very helpful for helping to control your blood sugar, which is likely to be an issue if you're having a problem with losing weight and you have PCOS. Weightlifting also helps to promote a healthy cholesterol profile, too. Yet another benefit. In fact, I could just go on and on about it, but we're going to stay focused for our podcast here. Now, some women with PCOS will avoid weightlifting altogether because they're afraid that they'll get really big muscles. especially if they know they have naturally higher than normal amounts of testosterone in their blood. And for some women with PCOS, that's true. They do have elevated levels of testosterone. So it makes sense to start with the lighter weights and gradually increase the amount of weight that you lift rather than starting at a really high weight range, just to see if your muscles become really bulky or not, if that is not what you want to have happen. And I have to say, for most women, getting bulky muscles is not likely to happen. It really isn't. But this is something that keeps women from doing weightlifting at all, is that fear. So for many ladies who do have struggles with PCOS, even with higher than normal levels of testosterone, weightlifting does not cause overly big, bulky muscles. It may lead to better muscle definition over time. It will certainly lead to being physically stronger, which can lead to feeling more powerful and more comfortable in your own skin, which is a good thing.
Absolutely. Absolutely. Beverly, this has been really helpful. I think you've kind of uncovered a couple common myths here in a very short amount of time, which has been really useful. Now, if you were to boil everything down to the single most important thing about exercise that women and girls dealing with PCOS weight issues need to know, what would that be?
Well, I'd say the number one most important thing about exercise here is that you don't need to be afraid of adding weightlifting or resistance training to your exercise program. You know, you want to stick to exercise plans that are fun for you, safe to do, and that you can do 5 to 7 days a week. It's all about sustainability, right? You got to keep moving. It's okay to have steady weight loss. Don't necessarily expect that you're going to lose all that weight in a really short amount of time. Think about the long-term horizon and your lifetime health. Don't get disappointed, so if you don't magically lose all the weight in a few weeks, have some patience and keep at it. You can do it.
Great words to live by. Beverly, thank you so much again for your time today and really for all this series of interviews. I feel like you've given so much value and so much great information.
Thanks, Ryan. It's been a pleasure.
To learn more about Dr. Beverly Yates and her programs and to get a complimentary free report containing weight loss tips and secrets all geared specifically for women with PCOS, simply visit PCOSweightlosstips.com. Once again, that's PCOSweightlosstips.com. Thanks so much for being with us. Take care.